Hi guys, thank you so much for tuning in to today's video part 2 of my ACL reconstruction update video. This part 2 will be my tips for those of you that are unfamiliar with post-op. Disclaimer, I am not a professional, I'm not certified in anything, I did not study in any of these categories. I am solely basing this off of my own experience and my own opinions. So if you have a question or if you have concerns, please consult a professional. Let's go ahead and get into this video. Tip number 1 is adjust your brace to desired tightness. And what I mean by this is that the brace that I had showed you guys, it comes with Velcro straps that you can adjust to your leg. And when you are first waking up from surgery, your leg is pretty swollen, okay? And it's already pre-tightened by whoever put it on you when you were out. So I would say definitely adjust it to your desired tightness, because when I woke up, I told the nurse that I was feeling pain in my leg right above my like in my quad area above my knee. I'll show you guys. So this incision right here, the brace was cutting into this incision, and I told her that when I woke up that I was feeling pain right here, and she said it was from the tourniquet, but actually it was the brace that was cutting into this incision, and it was so painful. So yeah, that's my number 1 tip, is to adjust your brace, because when I didn't adjust it and I took it off to ice my knee and then I put it back on, and it was so tight, when I tried to hook it back on, it squeezed my knee together, and that was when there was a bunch of like gushing feeling and like bloody discharge. It was really unpleasant, okay? So definitely adjust your brace. Don't keep it at the tightness that it was pre-adjusted for you when you got out of, when you woke up. Tip number 2 is buy multiple ice packs if you are not prescribed ice packs, because I know some people are prescribed those ice packs that come with a machine that's like an ice machine that keeps the ice pack cold, which is nice, but I didn't get it, so I had to buy my own. So I bought multiple ice packs so I can like go through each one, circulate, or what do you call it, I don't know, where I would use 2 and have 2 in the freezer, and then I would throw the 2 that I used in the freezer, and then by the time I need to use it again, I would use the other 2 that were in the freezers. Which leads to my tip number 3, is if you can, maybe get a like small freezer that you can keep in your room or by your bedside, so that you can have your ice packs handy at all times. This is good for people who live alone and don't have anyone who can care for them. For convenience, maybe buy a little freezer that you can have by your bedside, so you can have access to your freezer, to your ice packs at all time. Because I would wake up in the middle of the night and my leg would be throbbing and hot and uncomfortable. So definitely nice to have. Tip number 4, are we on number 4? Use a box. Now this is kind of like a hack, okay? I used a box to prop my leg on when I went to the toilet. Some people suggest you buy like those elevated toilet seats, because you will not be able to bend your knee, or I wasn't. And so I had to prop my leg up on a box so that I could use the toilet comfortably. And the box I used was just like a like 6-inch box, and it was just a cardboard box I had lying around. So that's like a hack. Just if you have like a cardboard box lying around, definitely keep it in the bathroom so you could prop your leg up. Or if you even have like a little stool, that works too, just because you will not be able to bend your leg and use the bathroom comfortably. Tip number 5, buy a shower chair. I bought mine on Amazon, and it was really inexpensive, and it really helps because my left leg was not strong enough to support my weight for a long or even a normal period of time. So I had to buy a shower chair so that I could sit down and shower. So it really comes in handy. Definitely buy a shower chair. That's a good investment. Tip number 6, prop up your entire leg on a pillow when you're sleeping on your back, because you will not be able to bend it or straighten it. It's going to be uncomfortable to do it. So definitely prop your leg up a little bit, not very high, just like a pillow, regular pillow height, under your entire, like maybe from your knee down where you were injured, to just be more comfortable when you're sleeping. Tip number 7, my butt felt really sore because I would be sitting for a long period of time or laying down for a long period of time. So my left butt cheek, only my left butt cheek got really, really sore. I think because a lot of the weight was sitting on that side because you're unbalanced. So I think because I was sitting on that side so much that it was really sore. And so to alleviate the pain, I would use a tennis ball. Sit on it, put it on the ground, and kind of sit on your tennis ball and roll it around the muscle that's really sore. Tip number 8 is if you are going to be sleeping on your side, this is for when you're further into the week of your post-op, definitely put a pillow in between your legs if you're going to be sleeping on your side with your surgical leg on the top. And you guys, when I was able to do that for the first time, to sleep on my side, I felt so good. Like, to sleep on my side, like the little things that you don't appreciate, they just feel so good, like when you're able to do them. Okay, and then tip number 9, start your physical therapy at your own pace. And I showed some of the moves in my part 1 video. You know, for me, I wasn't able to do a lot, so the only moves I could really do is to prop my leg up, or to kind of try to get my knee flush to the ground, the back of my knee, and also my heel slides, and then my quad pumps, which is pretty much all I can really do other than that, because I can't lift my leg up. So just do it at your own pace. If you can't do all the moves, you can't do some of the moves, don't do them. Don't rush yourself. Everyone is different. Everyone recovers differently. Okay, tip number 11 is also something that is suggested from the post-op staff, is to do calf pumps if you are not able to walk around, or if you don't feel like wearing the blood clot sleeves all the time. Definitely do calf pumps to help with circulation. So let me show you what those look like. You want to flex your feet, and then you want to push it out like that, point your toe. Those are calf pumps just to help with circulation, and I would do 10 of these about every hour or so, they suggest for you to do, to help with circulation. Okay, tip number 12. I'm not really sure which tip number I'm on. Rest as much as possible. Yes, I know it sounds so easy, but really hard also at the same time. It's just to rest as much as you can. Take your time. Your body is healing. It knows, you know, it knows that you're going through a hard time, and it knows exactly what to do, like to heal yourself. I mean, you'll definitely have to do physical therapy and things to help move it along, but your body is definitely healing. So give it as much time as possible. Tip number 13 is just to elevate your leg, which they also tell you to do. I said elevate it to help with flushing out all of the swelling in your feet, in your calves, in your knee, just to help it flush into your body, and that's where it kind of just disperses, I guess. Tip number, what are we on, 13? If you are a first-time crutch user, okay, wear t-shirts. Yes, wear your t-shirts, because I am a tank top lover, but when I started using the crutches, I had to switch to t-shirts because it just pinches your armpit, and I got a lot of the like, what are those called when it, like, it's like bloody abrasions, but it's not bloody, it like pinches your skin. That's what I got, a lot of those from wearing tank tops. So definitely wear a t-shirt. It helps with the crutches. That leads to the last tip that I have, which is carry a tote bag around with you when you're using your crutches, because you cannot carry things when you are holding your crutches. Carry around a tote bag so you could throw things in there and hold your crutches and walk around at the same time. So that was all the tips that I have for you guys. I might have missed a few, but for me personally, those are the tips that I have for you. Everyone is different, you guys, okay? Every body is different, and every surgery is different. Even though you have had the same surgery, like, your body processes the surgery differently from everyone else. So don't expect to reach milestones at the same pace as other people who have gotten the same surgery, because some people may be going faster than you, some people may be taking it slower than you. Everyone is different, so don't compare yourself to other people. Okay, it's not healthy for you. Definitely, just if you have questions, definitely ask your physician. Don't be afraid to do that, because if you feel like you're behind, ask them and they'll probably be like, no, you're doing fine. Like for you personally, you are doing fine. You're doing well. You're doing it at the pace that you need to be doing it, considering that you've just had surgery. You've just done something like drastic in your body. I hope you all heal up. For those of you who are going through this surgery or have had this surgery or will be having this surgery, I hope this helps somebody, anybody, whoever is going to get this surgery or has had this surgery, might be going through the same thing. Thank you so much for watching, and I will see you in my next video. Bye!